morning, good afternoon, and good evening, ladies and gentlemen, and my colleagues in Uganda. Thank you very much for organizing this opportunity to talk about patient safety in relation to hand hygiene in a commemorative day of World Hand Hygiene Day. I think safety and quality is highly depending on the practice of hand hygiene at every health facility. This is a very important topic for patient safety. Without this particular practice, we can't sustain our safety, and also we can't improve the quality of health services. Safety issue is very important as the foundation of 7 different managerial targets for hospital management. Our project entitled Patient Safety through 5S-KAIZEN-TQM in Uganda is working on this improvement of hospital management through the effort in collaboration with the effort of the ministerial level and also the hospital level managerial people. In order to establish safety, this is very important to establish safety culture in an organization regardless the rank and category of health services. However, safety culture is not so easy to build up. We have to start from the bottom, grade 1, improvement of rules and SOPs, and then we apply incident reporting system. Then based on the improvement done by the incident reporting system, we set quality indicator for every healthcare packages. Then later we will apply total quality management TQM for patient care in order to have further improvement of quality and safety, then institutionalizing those development in the framework of the hospital management. So I think 5 moments for hand hygiene is very important as an entry point of patient safety. However, as we have already experienced, technique is easy, but unfortunately hospital-wide practice is not so easy. We need to have a system establishment for that. I think this kind of information is very important. We have to set up regulation and rules. Then the availability of materials should be ensured. Improve our own attitude toward hand hygiene should be established. Then we should have a standardized practice. After that, hospital authority and then quality safety management body should have a monitoring and evaluation for further improvement of the hand hygiene practice for all staffs and then patient and visitors of the hospital. Kaizen should be applied for that particular purpose. If we have to look into the contents of global burden of patient safety, there are so many things, as you can see here on this slide, starting from medication errors to the mental health settings, unsafe care in the mental health setting. Number 2 is a healthcare associated infection. I think healthcare associated infection is very big issue. Within this particular category of the global burden, I think hand hygiene is very, very important. As you could see here, nowadays it was emphasized that those 4 different types of infection is predominantly happened in every healthcare facilities in the world. Central line related one, a surgical site infection, urinary tract catheter associated infection, and ventilator associated pneumonia. Those are problems. If we want to reduce healthcare associated infections, definitely we should have multiple dimension or multiple strategy for controlling infections. Number one strategy should be hand hygiene, as you are already well informed. Then for having this in hospital-wide practice, definitely we should have improved our own compliance. We have to develop or improve our awareness, and an attitude should be improved, and behavior should be a good one against IPC, infection prevention and control. Look into the general condition related to the existing data of prevalence of healthcare associated infection. As you could see here, there are some researches on that in African continent. One of them is done in Uganda. 4.9% of ICU patients were contracted healthcare associated infection, particularly multi-drug resistant microorganisms, and those are emphasized as an important target of the control. More than half of the cases are related to those multi-drug resistance microorganisms. Of course, we have a difficulty. Under chronic shortage of the health resources, can we control those difficult healthcare associated infections? The answer will be yes. If we could have an effort, continue our effort, I think this is quite possible. As you can see here, in one hospital, faith-based hospital in Uganda, there was a research on the application of the WHO infection control guidelines. Then they had a success to reduce more than 50% of healthcare associated infections. As you could see here, we are capable to control healthcare associated infection as an important entry point of hand hygiene practice. If hand hygiene practice is improved, we can control healthcare associated infection definitely. The entire patient safety could also be improved gradually. Then it will be connected to the improvement of quality of care. Then cost control will also be looked into by the hospital authority, and then cost reduction, gradual one, could be possible. Then in-house delivery of the medical services could be gradually improved. Then entire productivity of the hospital could be gradually in improvement trend. I think this is quite important to recognize hand hygiene practice is an entry point of the entire improvement of hospital management, particularly with patient safety and quality of care. We are using this kind of conceptual framework. We call it the pyramid or mountain of hospital management. We have 7 different layers to achieve our goal to make our people healthier and happy by our continuing effort of healthcare. The hand hygiene is very important. Thank you very much for your attention. We want to collaborate further in order to improve safety and quality of healthcare in Uganda. Have a good day. Thank you. Bye bye.